Good afternoon, everyone. This is Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. Today is April the 21st, 2021. We are in week 59 of the COVID pandemic here in Montgomery County. And today I'm happy to be joined by my colleague, Commissioner Ken Lawrence. So we'll start with some vaccine clinic updates. This week continues to be an uncertain week for our vaccination clinics. At this time, we still do not have firm guidance on what to expect in terms of vaccine supply for next week. The use of the Johnson & Johnson vaccine at our clinics remains paused until further notice. Anyone who had an appointment to receive the Johnson & Johnson vaccine with us last week or this week has been contacted and given the opportunity to reschedule their appointment. Since the announcement, we continue to only distribute the Pfizer vaccine. This Friday, the CDC will convene another meeting of the Advisory Committee on Immunization Practices to discuss the Johnson & Johnson vaccine. We will await further guidance on this matter. In the meantime, our team is planning for a variety of scenarios related to our vaccine supply. For instance, this week, we would have had over 16,000 first doses available if we had been able to use the Johnson & Johnson doses. Instead, we have a total of 8,190 first doses of Pfizer. So we lost about half our doses this week. We're still awaiting guidance on when we'll be able to use the Johnson & Johnson vaccine again and how much supply we will receive each week. As you can probably see, all of this uncertainty has made vaccine appointment scheduling challenging. I want to thank our clinic staff and volunteers for their resilience in being able to pivot operations over the last week with very, very short notice. I also want to thank our residents for their continued patience as we work through these issues. If we are able to resume use of the Johnson & Johnson vaccine, we will do so as soon as logistically possible and begin to release more appointments. Our goal remains to get as many shots in arms as quickly and as efficiently as possible. Our vaccine clinics continue to offer appointments through the end of April, and we will begin to offer appointments in May as soon as we have some certainty about how much vaccine will be available to us. Anyone who books with us will have the ability to choose their clinic location, the date and time of their appointment, and the vaccine that they receive. This is an important note for people who are booking their second dose appointment. So these are people who've gotten Pfizer for their first dose and need to schedule a second dose. You will get an email to schedule your second dose shortly after receiving your first dose. In our registration system, you will have to choose a date that is at least 21 days from your first dose. If you choose a date that is less than 21 days from your first dose, the system will tell you that there are no appointments available. So please keep that in mind when you pull up your calendar to schedule that second dose, that you must go at least 21 days out from when you got your first dose. As a reminder, if you or a family member have any appointment issues, please email covid19@montcopa.org or call our hotline at 833-875-3967. Now that vaccine eligibility is open to all, anyone can register with us to receive the vaccine. To ensure equitable access for all as we continue our rollout, vaccine appointments within each phase will be released randomly, not by the date registered. And as I've said before, eligibility does not quite yet equal availability. We will continue to release appointments as quickly as possible based on our vaccine supply. Now let's take a look at our updated vaccine clinic map. We continue to maintain 7 clinic locations across the county with daytime, evening, and weekend hours. Starting on May the 3rd, I'm going to say this again, starting on May the 3rd, we will be moving the locations of 2 of our clinics to better serve our residents. The site at Norristown Area High School will move to our new King of Prussia location, located within the old J.C. Penney store. Again, that's at the King of Prussia Mall. And similarly, our site at Montgomery County Community College will move to the Montgomery Mall. So please take note of these location updates. It's now possible that you'll have your first dose at either the Norristown High School or the Montgomery County Community College, and then your second dose at the King of Prussia Mall if you went to Norristown first, or the Montgomery Mall if you go to the community college first. All of these locations will be updated in the vaccine registration system and on our website. As a reminder, you can register online or by phone to receive the vaccine through our COVID-19 hotline. To pre-register for the vaccine by phone, you can call the hotline at 833-875-3967 and let the agent know that you need support in pre-registering for a vaccine. Please note this service is prioritized for seniors and those who do not have internet access. We also want to remind residents that no-cost transportation is available to all vaccine appointments in Montgomery County. There are currently 3 options through Transnet, SEPTA, and GoGo Grandparent for anyone who needs a ride to their vaccine appointment. And you can see those numbers on the graphic. We encourage anyone who needs transportation to call the numbers listed on the screen. And if you aren't able to get those down quickly enough, you can also call our hotline and get access to that information. So here is our weekly update for how we're doing as a county in getting our community vaccinated. So we'll walk through this starting with the upper left-hand side of the chart with the county administered vaccinations. And you can see that between our community vaccine clinics, our first responder clinics, and our mobile clinics, we've now given 79,179 first doses and 51,647 second doses. That chart below shows the different types of vaccine that we've had available and how many doses of each we've administered. And then on the right side, this is these numbers include vaccine given to any Montgomery County resident, whether they got it at one of our pharmacy partners or in some other part of the state. So let's start over on the right side. If we look at the individuals who are 65 years of age and older who live in Montgomery County, we now have a total of 87.59% having received either their first or second dose or a dose of J&J. So in other words, they're either partially vaccinated or fully vaccinated. So this is great news to have that number in the group that was so vulnerable to this virus to be at 87.6% is really great news. The next group is those that are eligible for the vaccine. And so those are individuals that are age 16 and up. And we now have 54.74%, basically 55% of those individuals that are either partially or fully vaccinated. So great progress there. If we look at this as a percentage of our total population in the county, then we see that we have 44.35% of our population vaccinated. So we're making good progress. I want to thank everybody for working hard to get an appointment, to get to the appointment, to come back for your second appointment. This is how we keep our whole community safe. And then, as you know, we've been very carefully tracking the race and ethnicity of the vaccinated population here in Montgomery County and comparing that data with census data for the racial and ethnic composition of our community. As you can see in the right-hand column on the lower right, we are making steady improvement week over week in reaching all members of our community. For example, individuals that identify as African American or Black make up 9.6% of our population and are now at 5.8% of the vaccinated population. This is an increase from 5.5% of the vaccinated population last week. We continue to ask people to please identify your race and ethnicity when they register for an appointment. You can see that we still have 1 in 7 people who have not identified a race and 1 in 4 who have not identified an ethnicity. We are using this data for only one purpose, and that is to make sure that we do not leave anyone behind in our efforts to vaccinate everyone in Montgomery County who wants to be vaccinated. Moving on to our regular update, since the April 14th press briefing, we have 1,483 new cases of COVID-19 reported in Montgomery County for the dates inclusive of Wednesday, April the 14th through Tuesday, April the 20th. This is a daily average of 212 cases and brings us to a total of 55,497. These positive cases are a result of a positive test for the virus, not from an antibody test. 8 of these cases were from long-term care facilities, 5 were from the Montgomery County Correctional Facility, and 19 were from other congregate settings, and 1,451 were from the community. These positive individuals are from 60 municipalities. As you know, all 62 Montgomery County municipalities are home to individuals with COVID-19. Today's individuals range in age from 5 months old to 97 years old, and you can check the county map on our data hub for more information. You can find that at www.montco.org/COVID-19. Today, we have 753 females, 727 males, and 3 unknown. In terms of the variants, we are now up to a total of 186 identified variants in people who live in Montgomery County. As a reminder, only a fraction of the samples are being tested for variants. So this is just really for information purposes only, but also as a reminder that we do have variant forms of the virus among us. Primarily, we have the B117 variant. We have 170 of the 186 cases are that particular variant. That's the British or the UK variant. We also have 4 of the B1427 variant, 11 of the B1429 variant, and 1 B1526. I am also sorry to confirm that 2 additional Montgomery County residents have lost their life to COVID-19, which brings us to a total of 1,276 deaths confirmed positive from COVID-19. Both of these individuals were age 78, and both passed away in a hospital. Overall, 649 females, 627 males have lost their life to COVID-19 in Montgomery County. They ranged in age from 25 to 106. The situation remains stable at the Montgomery County Correctional Facility. Routine antigen testing continues for all correctional officers. All inmates who have tested positive are stable, and we are in the process of offering vaccination to all inmates who wish to be vaccinated. Our positivity rate is slightly increased this week compared with last week. Our 14-day average positivity rate is 8.22% as of Thursday, April the 15th, compared with 8.12% as of Thursday, April the 8th. As a reminder, a positivity rate below 5% is considered suppression of the virus. This next graph shows the daily positivity rates for March 19th through April the 15th. And you can see that the daily positivity fell below 5% on only one of those days. And you can see with that purple line, that steady increase of positivity, although it does appear that we may be plateauing, which would be great news. Our hospitalizations are continuing to increase since last Wednesday. Today, we have 228 individuals with COVID-19 hospitalized in a Montgomery County hospital. This is increased from 213 last week. 8.3% or 19 of these individuals are requiring a ventilator. This is also increased from last week. Our hospitals do remain busy. And just as a reminder, on October 1st, there were only 24 patients hospitalized with COVID-19 in a Montgomery County hospital. In terms of testing, for the 14-day period ending April 15th, 41,987 Montgomery County residents were tested, which is an increase of 46 people tested compared with the 14-day period ending April the 8th. And next, we'll pull up our date tested graph. This is a picture of the pandemic from its beginning back in March to a year ago to where we are today. And as a reminder, the gray bars are the number of positive cases on any given day. The red and the pink lines are the 7 and 14-day averages of all the cases. The dark blue and the light blue are the 7-day and 14-day averages of cases from the community only. And the orange and yellow lines way down at the bottom are the 7 and 14-day averages from long-term care facilities. Next, we'll zoom in on the last couple of months. And you can see we've had this several week increase in our 7 and 14-day positivity, but it does look like we are starting to level off. And hopefully, if we continue to be careful, we'll see those numbers start to come down. We continue to have good availability of testing, and I want to urge anyone who wants or needs to be tested to get tested. We have testing available at all 6 locations across the county with varying hours each day, Monday through Friday. And as a reminder, it's very easy to get tested at one of our sites. You don't need a doctor's appointment. They are no cost to you. We will test anyone, whether you're having symptoms or not, and we'll test people of any age. The only thing you do need to do is to make an appointment, and you can do that online at montcopa.org/COVID-19 and click under the COVID-19 testing header at the top of the page. Appointments open up at 7 a.m. on the day of testing. You can also make an appointment by phone, and you can do that by calling 610-970-2937, and that opens at 8:30 in the morning. And we do have language line affiliated with that phone number, so you can speak in any language in which you are most comfortable. So that's it from my end. I'm going to turn over to Commissioner Lawrence here in a second, but just want to remind everyone that we still have a lot of cases out there. We have not started to come down. I'm hoping that we are leveling off. Our hospitalizations continue to go up, and we're averaging over 200 cases a day, brand new cases. So we're making great progress getting people vaccinated, but we don't have enough people vaccinated yet to be anywhere close to herd immunity, where we might really have true suppression of this virus in our community. So in the meantime, please, please be careful. We still need to be wearing masks, socially distancing, being very cautious about attending any kind of indoor events, particularly small events in homes where some of the mitigation measures that are in place in more public settings may not be available. And just be safe out there. We're so close to the end. It just breaks my heart to see people getting sick when we can really see the end in sight. And with that, I'll turn over to Commissioner Lawrence.
All right, thank you, Commissioner Arkush. I just have one announcement today, and it's with regards to our rent and utility relief program, which continues to receive lots of applications, but we still have funds available, and the application window is still open for renters suffering financial losses due to COVID-19. The CDC eviction moratorium was extended through June 30th, but we know that many of our residents still need additional protection as bills are due. The Montgomery County Rent and Utility Relief Program, administered by Your Way Home, allows eligible households to receive up to 12 months of assistance for rent and utility bills dating back to March 13th, 2020. Assistance can be for past due rent, utility payments, or future rent payments. Funding for security deposits, first and or last month's rent is also eligible as part of this program, and there is no financial limit on the amount of assistance a household can receive. And we have $55 million available for the program in Montgomery County through a combination of state and federal funding. With this amount of funding, we are aiming to serve between 1,900 and 3,800 households. Your Way Home and our community partners are processing applications as quickly as they can. So far, 1,077 Montgomery County households, up from 500 in April, on April 7th, have received $5.1 million, which is up from $3 million in funds given to those in needs. Eligibility requirements for the rent and utility relief program include the household must reside in Montgomery County, and one or more individuals in the household has qualified for unemployment benefits or experienced a reduction in household income, incurred significant costs, or experienced other financial hardship due directly or indirectly to the COVID-19 pandemic. And the household can demonstrate a risk of homelessness or housing instability. And the household must be at or below 80% of the area median income at the time of application. To apply, residents are encouraged to call 211 or text their zip code to 898-211. Applications can be done over the phone, in person, emailed, or a combination of all of the above. Residents can also reach out to one of these 6 partner organizations to learn more about the program and apply: Aclamo, Family Services in Montgomery County, Manna on Main Street, YWCA Tri-County Area, CADCOM, and the Pottstown Cluster of Religious Communities. All of this information can be found online at www.yourwayhome.org/ERUC, or as I mentioned, you can call 211 for more details. So if you know anyone who lives in Montgomery County that is struggling to pay their rent or utility bill, we encourage you to share this information with them so they can apply, or if you need to apply yourself, we are accepting applications on a rolling basis. That concludes my announcement, Commissioner Arkush.
Thank you. All right. So with that, I will remind everyone that our next briefing will be Wednesday, the 28th at 1:30, and I'm happy to take any questions.
Our first reporter will be Jim Melward from KYW.
Have any schools in Montgomery County had linked transmission to the level they might need to reconsider their instructional model? Or have they reached out to the county saying such?
Attention, all members of the Appropriations Committee. The Appropriations.
Where are you, Jim? Not that I am aware of. I
Attention.
believe there have been a very small number of suspected cases of linked transmission, but not that would reach the level of concern that there would be discussion of closing a school. But we can get confirmation on that for you.
Thanks. Apologies for the state senate bleeding in there. Are you seeing the increase in demand? And I know this is hard to answer because of the Johnson & Johnson pause, but are you seeing the increase in demand that you would have expected with eligibility opening up to everyone 16 plus?
Yeah, we actually are pretty busy. I know there's been discussion in other parts of the state that they are not so busy, but here's what we're seeing. So next week, we have about, I think in total, 7,000 appointments available, and all but I think 400 or 500 are filled. But we have appointment invitations out there that we assume that people are still deciding, when to actually come. So the vast majority of our appointments are booked, and we also still have 18,000 people signed up in our system. Those folks have all signed up for the most part in the last 10 days or so. Now, it's possible that some of those people are getting appointments other places because there's been a lot more availability of appointments, but we have had 18,000 people sign up just in the last, week or 10 days. So I think we'll have a clear sense. We did have to reschedule a number of people who were originally supposed to receive a Johnson & Johnson vaccine at the end of last week and into this week. So I think once we work through that cohort, we'll have a better sense. But so far, we're pretty busy.
And I realize this question is going to a county official about a federal program in state-run facilities, so you may not be able to really answer it. But I had someone reach out that they had a loved one move into a nursing home here in Montgomery County. The home was already vaccinated. This person has not received their vaccine. They can't leave the home, and they're not really getting much direction from the facility. Is there any advice to someone in that situation?
Yeah, it is my understanding that the Pennsylvania Department of Health is working to come up with a program for that particular situation.
Thanks.
Next, we'll go to Carl Hessler from the Pottstown Mercury.
Good afternoon, Commissioners. Are you still able to operate your mobile vaccine program given the J&J pause right now? And if so, how successful does it continue to be? And how many people do you think you have reached through that program so far?
Yeah. All right. Well, I'll work backwards. I can tell you exactly how many people we've reached. As of, I believe this morning, we have reached 1,257, or we've administered 1,257 first doses and 788 second doses. And I believe this week, just by, I guess you could call it luck in some ways, was scheduled to be all second doses of Pfizer. So the fact that we didn't have any J&J this week has not really impacted that particular operation as of yet.
Okay, so it is. So you're continuing with that as we speak. You're able to continue with it.
Yeah, that's
Okay.
correct. We have never had a problem getting second doses here in the county. So we have all of the Pfizer second doses that we require.
Okay, and are you still going out to congregate care settings, or have you now been able to reach some of the individual homebound people?
So we are, I believe this week at congregate settings, giving second doses. So that original cohort of, 30 some places. We did a really great partnership with one of the giant pharmacies before we actually had J&J to reach individuals experiencing homelessness, and we're able to do some of those individuals before the pause was put on the J&J. And we have not yet officially started the homebound population. Although when I say we haven't officially started it, our team hasn't gone out, but we are working with some of our partner pharmacies, some of whom are setting up some drive-through opportunities for homebound seniors. So we are connecting the seniors on our list who might be able to get a ride to a place, but just can't simply get out of the car and go inside, to a pharmacy that could be offering that service. So I don't have any results of that yet. We really are just starting that this week, but we are doing everything we can to get those individuals vaccinated. And then we'll see what happens with the J&J, but it would be our preference, assuming that it's acceptable to the individual, to just go into a person's home once. But we'll have more clarity on that, hopefully after Friday's ACIP meeting.
Okay, thank you. That's all the questions I had today. Thank you very much.
Yeah.
Our next reporter will be Deanna Durante from NBC 10.
Hello, I have a couple of questions, and you may have touched on some of it already, but I'm just going to go through them, mainly on the J&J delays. Fast forwarding to if on Friday they say, sure, go ahead. What does that reintroduction look like for appointments and for people who may be hesitant? And how do you move forward, kind of working that back into the system?
Yeah. So right now we have people scheduled in Johnson & Johnson clinics beginning next Wednesday. We did cancel the individuals who were scheduled on Monday and Tuesday of next week. So starting next Wednesday, we would continue on with those scheduled J&J clinics. And then we would reopen some locations that we just don't have enough vaccine to run. And there's at least 2 of those. So we would look to start all of that on Wednesday. And if an individual is scheduled in the J&J clinic and they wished to make a change, then our system allows an individual to just simply go back through the email that they received, and they have an option of canceling or canceling and rescheduling. And someone could click the cancel and reschedule, and then they could schedule into a clinic that offered, in our case, Pfizer. That's our other option here at the county. So we're trying to give people as much flexibility as possible.
Are you having any cancellation issues? Some counties are saying that they're having cancellation issues, and then they have, and not just counties, but providers, and then they have extra doses.
My team has not told me that that has been a problem.
There's talk of a regional site coming now, again, to Lincoln Financial Field. Would a regional site like that, where anybody can go, where it wouldn't just be Philadelphia, it would be open up to the suburbs? I'm assuming that I know the answer to this question, but would that alleviate the pressure in Montgomery County to get more people vaccinated, since we've already seen people driving further than Norristown and Pottstown?
Yeah. I'm sure for some people, if it was convenient for them, absolutely, it would be helpful. But my sense is that we're just about done with almost everybody that's in 1A, B, or C. Just about. We still have some, but we're getting awfully close. And there seems to be more availability through pharmacies and other partners around here now. So, and particularly if we get Johnson & Johnson back, we would have quite a few appointments next week that would then open back up. So I don't know how helpful it would be right now. I think that's just going to be remain to be seen in terms of what we actually get here in first doses.
Are we going to have, I have a couple more questions, but I don't want to take up time from anybody else. So Todd, are we going to have another round, or can I just jump in with two more?
If they're quick, Deanna, they're very quick.
They're
Okay.
quick. I'm just curious. So when you said that 18,000, I just wanted to get clarification. So are you saying that you've gone through 1A, 1B, and that 18,000 are new people who have signed up in the last couple of weeks, or is that 18,000 still left over from 1A?
Those are 99% of those people are twos that have signed up in the last 10 days or so when we opened up registration to anybody.
So that's anybody. That's not from any of the groups. It's just anybody who wanted it.
Correct.
Okay.
Anybody 16 and up.
This one may be a complicated one, or one you just don't have an answer to. So we keep hearing about booster shots. How is that going to work? Do we know yet how that could work now? I mean, I realize we're not through the shots, but is that something that then has to come through the county again? Is that something you're talking about, and how to plan?
And you know what, until booster shots are real and we actually know that we're going to need to get them, which we don't yet, we're not making plans for that. We want to get everybody through this first round. Our goal is to get at least 75 to 80% of our community vaccinated. That's our first, second, and third priority right now. And if we do need to give booster shots down the road, we'll be ready to do that.
Okay, thank you.
Next, we'll go to Justine McDaniel from the Philadelphia Inquirer.
Hi, Commissioner. I wanted to go back to the vaccination efforts for homebound, homeless people, people in congregate care settings, the mobile efforts. What pace is fast enough? Obviously, it's a little bit of a slower endeavor because you have to reach people individually. So how will you measure whether that's going at a good pace and also having enough uptake and interest from folks? Is there like a month you'd like to have a certain percentage vaccinated by, or any goals like that?
Well, our goal is to vaccinate everybody who wants to be vaccinated. And so right now, as of this morning, we had about 200 individuals registered on our homebound list. And if you would like to register yourself or a loved one, you can call our hotline and we'll take all of your information and then we'll call you back when we're able to come to you. So that's our goal. It's a simple goal. Anybody who wants to be vaccinated, we want to vaccinate them. The homebound process is a fairly lengthy one because remember that we do need to sit with the individual for at least 15 minutes, perhaps even a little bit longer if they have any sort of complicated medical issues, which I'm guessing many of these individuals will. So the number of people that we can do in a day is pretty limited. Once we have, we're hoping, the ability to just go to an individual's home once with the Johnson & Johnson, then we have plans to have 2 to 3 teams out on any given day that would be doing that work. So we'll get through it as quickly as we can, and we'll keep going until everybody who would like to be vaccinated is vaccinated.
Okay, thanks. And then I was just curious, there was an article in The Atlantic that people are talking about, an idea is going around that we don't really need to be wearing masks outdoors anymore. What's your take on that from a public health standpoint?
Well, right now, with the numbers of cases and positivity rates, incidence and positivity rates in the 5 southeastern counties, I think that the guidance has to continue to be the same. That if you are outdoors and you're within 6 feet of someone who is not from your household, you should have a mask on. If you're just outdoors and you're with, walking with your family or out on a run or a hike by yourself, I don't have a mask on when I'm doing that, but I always have a mask with me. And if I approach anyone, I just put the mask back on. It's so simple to do. So we are just not in a place right now where we can relax these measures.
Thanks, that's it. Thanks, that's it from me.
Our next reporter will be Krista Shoemaker from the Intelligencer.
My questions have all been answered, so thank you very much.
Our final reporter will be Maggie Kent from 6ABC.
I think we've addressed this, but I just wanted to hammer the point home. Thank you, Dr. Arkush. My question is surrounding, I'm hearing from FEMA sites in Philadelphia that they're not seeing the same amount of people come up. I'm hearing from Delaware County, they're not seeing the same people sign up as well for vaccinations. I know that you saw 18,000 sign up in the last 10 days, and obviously you'll have to get through those people. Are you seeing, in terms of numbers of people being vaccinated, people not showing up for their appointments, or maybe not as many walk-ups as you may have expected?
We're not seeing that in Montgomery County. We had an awful lot of pent-up demand here for months, as you all are well aware, while we waited to get more vaccine into this county. So I think we're still working through a lot of people that have been waiting a long time to be vaccinated, and they seem pretty eager to do so. So far, as I mentioned earlier, our clinics are pretty full.
Has there been any conversations with surrounding counties or Philadelphia about allowing people from Montgomery County to cross over, residents of Montgomery County to cross over and get vaccinated elsewhere where they are seeing those empty spots?
Not specifically to address that particular issue. Just as a reminder, for the 4 suburban counties, we have always vaccinated each other's residents. That was a directive from very early on from the Pennsylvania Department of Health, that none of the 66 counties that were receiving vaccine from the Pennsylvania Department of Health were allowed to turn away anyone based upon residency. So we've all been doing that for a while. And I think many people might have found it to just be more convenient to go to one place or the other. Now, Philadelphia has been under a different set of guidelines. And I know, at least for a time, they were only supposed to be vaccinating people from Philadelphia County. I know it didn't always turn out that way, but I don't know that they have changed those guidelines. I'm not certain. You have to ask them.
Thank you.
That concludes our questions for today.
Great. Thank you, Megan. And thank you, everybody. We'll see you next week.